provide a synopsis of the case?
So the patient is a 24-year-old female with a spinal cord injury, complete spinal cord injury at the level of C7 due to a motor vehicle accident 2 months ago. She currently can tolerate sitting upright for 5 hours and has begun training in wheelchair skills, transfers, and sitting balance. And she has no spinal precautions, and she no longer is using her abdominal binder.
Are we good? Okay. Okay, go ahead and state 3 major muscle innervations at this level.
So 3 major muscle innervations at this level are the triceps, the extrinsic finger extensors, and the wrist flexors.
Okay, and then state 2 available possible movements that are specific to this myotome.
So 2 available movements for this myotome are elbow extension and wrist flexion.
Okay, and then go ahead and state 2 short-term goals. Remember to use the SMART and function format.
So one short-term goal for this patient would be to increase her straight leg raise range of motion to 100 degrees so that she can long sit better, which would facilitate better transfers, self-dressing, and mobility in 3 weeks. And then another short-term goal in 3 weeks would be to transition from a moderate assist with bed mobility and transfers to a minimal assistance in bed mobility and transfers in order to increase functional independence.
Okay, so we're starting in supine. I want you guys to demonstrate a passive range of motion hamstring stretch. But before you guys do this, make sure to do your introduction, name, date of birth, consent, and then go ahead and you're going to demonstrate a passive range of motion hamstring stretch in supine.
Yeah.
Hello, my name is Hannah Waples. I'll be your student physical therapist. Before we get started, can you please confirm your name and date of birth?
My name is Devin Michael Holloway. I was born on March 13th, 1998.
Perfect. Okay, so today I'm going to be helping you move around in bed a little bit better, and we'll get you sitting at the edge of the bed. Does that sound okay?
Sounds okay.
Okay, so the first thing we're going to do is called a hamstring stretch, and I'm going to do the work for you, so just lay back, and I'm going to be lifting your leg, okay? So tell me if you feel any stretch.
Yes.
And we're just going to hold this for 30 seconds, and we'll do it 3 times on each side.
Cynthia? Okay, are you good? Okay. So, what is the ideal hamstring length to maintain long sitting and transfers?
The ideal hamstring length for long sitting and transfers is 110 degrees.
Okay, and then go ahead and you're gonna instruct your patient on a self-needed chest stretch. Make sure you talk to them about, give them feedback on that and how long they're supposed to hold that. So a self-needed chest stretch that the patient's gonna do themselves.
Okay, so since you have really strong biceps, I'm going to have you grab your leg and pull it into your chest. So first we're gonna sit up. Hold on a second. So you can prop on your elbows a little bit. Good, and then go ahead and grab onto your leg if you can. Good, and you can go ahead and lean back and pull your knee into your chest. Perfect, you can use both hands if you want. And you're just going to pull that knee into your chest until you feel a stretch. And you're going to do this 3 times on each side for 30 seconds each. Okay? You can put your leg down. Thank you.
Christian, are you good? Okay. So go ahead and you're going to demonstrate supine to rolling. You could either do right or left. And just remember the patient is mod assist, so you are going to provide assist with the rolling.
Okay, so now we are going to practice rolling. And so the biggest thing with rolling is that gravity and momentum are your best friend. So what we're going to do is we're going to scoot you over a little bit first. So you can use your arms to help me, but we're going to scoot you toward your right. Ready? 1, 2, 3. And again, ready? 1, 2, 3. Okay. So I'm going to have you grab your arms together up here, and you're going to swing side to side and get some momentum. You're going to do this 3 times, and then you're going to use momentum to draw your body over onto your side toward me. Okay? And then while you're doing this, you can use your head and neck turning at the same time as your arms so that you can use these motions to help with the momentum and getting you on your side. Okay? So we're going to go back and forth. 1, 2, and 3, and then you're going to roll over. Good. We can try that again. Ready? 1, 2, 3. Good. I don't know if she wants us to stay here.
Okay. So go ahead and state one way to facilitate rolling. How would you make it easier?
So to make it easier, we could have the patient
You don't have to perform it, just state how you would do it.
To make it easier, we could have the patient either hook legging or cross their legs, and we can assist more at the hips and shoulders. So I was assisting at his shoulders to help, and his hips to help his upper extremities, his trunk, and his hips to come over. So we could just provide more assistance, or again, hook line, crossing the legs, helping the patient get over a little bit easier.
Okay, and you don't have to perform it again, but just state one way to progress rolling. How would you make it more challenging?
So to make rolling more challenging, we have it pretty challenging here on a soft surface, but incorporating sheets and blankets so that the patient gets more used to having to roll in a more functional environment. Also having the patient's legs completely straight and flat, not crossed at all, and using less momentum and less turning to get over.
Okay.
Are you okay?
Okay. So now your patient is side lying. So go ahead and you're going to do side lying to supine on elbows to long sitting to edge of bed. Okay, so side lying to supine on elbows to long sitting to edge of bed. So just know that they are mod assist, so guard appropriate and provide as much assist as a mod assist person would need.
Okay.
You want
So-
sideline to supine elbows or sideline prone on elbows?
So they're starting side lying, so they're gonna go sideline to supine on elbows, and then supine on elbows to long sitting to sitting at the edge of the bed. So they're gonna end it sitting at the edge of the bed. And it's okay if you guys, if we take breaks in between and your hands are off to be able to do this, okay?
Okay. So now that we're laying on our side, we're going to get back to our back, but when we roll over, I want you to try to prop on your elbows. So you can, I'm going to help you roll, but when we roll, you're going to use your elbows to sit up onto your back.
Okay.
Okay, so the patient's starting side lying, so you're gonna go side lying to supine on elbows to long sitting to then sitting at the edge of the bed.
So the way that we're going to get you back onto your back is I want you to try to use this shoulder and your arms to propel you backwards. So again, we can use momentum. We can do a little bit of rocking until we can get onto our back, okay? So let's first go to your back, and remember we're going to prop on our elbows, okay? Okay, ready? And again, you can use your arms to pull you back. Ready? 1, 2, 3. Prop my elbows. Okay? And now I'm going to help you sit up a little bit higher, but you're going to throw one arm back. We're going to shift toward this side, unweight this arm. You're going to throw this arm back and lock it out. Ready? Weight shift, and arm back. Good. Now come back over towards me, and other arm straight. Good. How you feeling there?
Fine.
Okay, so now you can use your arms and your shoulders to get your arms a tiny bit closer together. Give you a little bit more stable. Good. So now from here, we're going to have you lean to the other side. You're going to use this arm to grab this leg, and you're going to pull it towards me so that we're coming off the bed. Good job. Grab and pull. Okay, you can set this arm back behind you again. And use the other leg to grab and pull. Good. You can set that arm back behind you again. Now we're going to lean this way. You're going to grab with this arm and pull. The chair in your way.
Are we leaving them in long sitting?
No, they're sitting at the edge of the bed.
Oh, okay.
Okay.
Okay, and then you're going to lean towards me and grab with this arm, good, and pull. And put this arm back behind you. And we're going to shift this way a little bit, good. I'm going to put this gait belt on you. For stability, how are you feeling there?
So you said we can pause and get them closer to the edge of bed in order to begin.
Yes,
Okay.
yes.
The edge
So
of bed, okay.
your patient should be sitting at the edge of the bed is where they should be at the end.
Okay.
Okay.
So we're, yeah. So you can use your elbows to bring you a little bit closer. Good. And we're going to scoot you a little bit this way. So I'm going to have you lean one direction. And you're going to grab this leg with me. We're going to scoot it forward. 1, 2, 3. Good job. Put this hand back. We're going to lean the other way. Grab this leg. We're going to pull it forward. 1, 2, 3. Good. And you can sit up there. How are you feeling?
Fine.
Okay. Okay.
I'm supposed to go back down here.
Okay, so while your patient's sitting at the edge of the bed, I'm gonna have you do two things, okay? So you're gonna do a static sitting balance intervention and a dynamic balance intervention. So for each of those, do them separately, and you're gonna provide your rationale as to why you chose the static one and why you chose the dynamic one, and then you're gonna do that with the patient. Okay, so one static, one dynamic sitting balance activity. And why?
Okay, so shut this door. Okay, so for our static sitting balance, I know that right now we're able to keep sitting upright using both of our arms. So we're going to try to transition to just using one arm. So the static sitting balance intervention would be using one upper extremity as opposed to two, so that we can facilitate that functional independence and maintaining sitting balance with using only one upper extremity. Okay, so we're going to have you scoot forward a little bit more so that your feet are touching the floor. Good. Okay. So I'm going to be here to support you, but I want you to gradually try to shift on one side, and you're going to gradually start to lift up the weight from the other side. Okay? So I want you to use only one arm to keep you sitting
Do
upright.
you want how long we would do this and everything to explain?
No.
So we're going to try to start shifting. Good. You can try to slowly start taking that arm off. Good. How's that feel?
Fine.
You can go ahead and put your arm back. And then for dynamic sitting, we're going to be doing some reaching exercises. So again, I'm going to have you be supporting on one side, and I want you to reach with your other arm. So you're going to again shift to one side, and then you're going to use your other arm to give me a high five. Okay, so ready? Shifting, and high five, good. How about up here? Good. Over here, good. And we're doing this, we're gonna do both upper extremities the same way so that we can challenge dynamic balance by creating perturbations with the movements of the upper extremities. So now we're gonna shift on to the other side. Good. You're gonna high five me with this hand. Good. Good. Out here. Good. And we're moving outside of the base of support to challenge the dynamic balance. Good.
Okay. So go ahead and you're gonna do a bed to chair lateral scoot transfer. So bed to chair lateral scoot transfer.
Okay. So the next thing that we're gonna do is we are gonna get you into this chair. So I'm gonna be helping you out, but I want you to push off with your arms as much as we can, okay? So we're gonna scoot also a little bit at a time so we don't have to get into the chair on the first movement. But I'm gonna be having you lean towards me to kind of unweight your hips a little bit. And then you're gonna scoot. Okay, ready? 1, 2, 3, scoot. And you can bring your hands a little bit in front of your hips. Might help you out a little bit. And you can push off with your hands. Ready? 1, 2, 3. And one more. Ready? 1, 2, 3. And one more. 1, 2, 3. Good.
Okay, so go ahead, in this position, go ahead and instruct your patient on pressure relief. Make sure you assess that they are making appropriate pressure relief and talk to them about how long they're supposed to hold it.
Okay, so when we are sitting in a wheelchair or a chair for long periods of time, that puts us at risk to develop pressure sores, especially on the bones that we're sitting on. So what we want to do is start giving you a pressure relief program that you can practice at home and just throughout the day. Our goal initially is going to be 30 seconds of pressure relief for every 30 minutes, and then we're going to work up to 60 seconds of pressure relief every 30 minutes. So the way that we are going to relieve pressure in this case is by leaning forward. So all I want you to do is, if you do have a chair with arms, you can hold on to the arms or like your wheelchair, or you can just go ahead and drape your arms over your legs. And we're just going to lean forward. And we just want to make sure that we're getting the weight off of where you're normally sitting. So I want there to be a little bit of a space under here. So you're just leaning forward, stretching as much as we can. And again, we want to do this for 30 seconds every 30 minutes. And I think we can sit back up. Oh, sorry, we're doing forward pressure relief. We can sit back up. Good. you could see.
Okay. Last one. Okay, so just state 2 long-term goals. Remember the SMART and function format. 2 long-term goals.
Okay, so within 6 weeks, I want to increase this patient's straight leg raise range of motion to 110 degrees. And again, this is to facilitate long sitting, and this will help with transfers, bed mobility, self-dressing, and overall functional independence. And then I also would like to increase his bed mobility.
When we're done, you can stop recording.
Want to increase his bed mobility to be a modified independent in the next 6 weeks, so that he can continue to improve his functional independence. And that's all.